Okay, I'm going to introduce myself just for the purpose of the video. Of course, y'all already know who I am. I'm Pat, and I'm doing a project I did for my class at WT this semester, and it was about chronic care management. And I'm not going to introduce y'all to the video, but just to say that you're medical assistants that work in the clinic with me, and that you know you're being recorded. Since the computer doesn't work sometimes up here, I just went ahead and printed out my slides. So if you notice on the first page, it tells you that this is my Practicum project and that it was about chronic care management. Since y'all have already been involved in chronic care management, I didn't really want to do my presentation with you about it because you're as familiar with it as I am so far. So I kind of wanted to just touch on a few things with you. And I'm doing this in a real short version, but if you have questions afterwards, you're welcome to ask me and I can tell you more about it. So the first page talks about nursing theory and the reason that we use nursing theory. And it's to help us to understand reasons for what nurses do, how we do it, and to find out other things that we need to learn about it. It defines areas where knowledge is lacking, which is what I just said, and provides nurses with an understanding of purpose and role in the healthcare setting. If you go to the next page, this chronic care model is what I really based my project this semester on because it has so much to do with chronic care management. If you notice in the big bubble, it talks about the health systems and the organizations and the community and self-management support, which we do a lot with the community and trying to get patients to have the ability to self-manage their chronic conditions. And then clinical information systems, like what we do with the computer. So then if you look down beneath that, with the arrows going back and forth, that if we can have an informed, activated patient and a prepared, proactive practice team. And that's us. We're the practice team with the doctors and the nurses. And if you will turn to the next page, and that talks about more about the chronic care model, that we do use a team approach when we treat our patients. Similar to how we're a team with chronic care management. We have the doctor, the nurse for the patient, and then the chronic care management nurse that patient learns to identify with, learns your name, and knows who it is. And then the community providers, depending on the patient's needs, the way we refer them to get their eye exams if they haven't had it, to the podiatrist for a foot exam, diabetes education, encouraging the patients to be knowledgeable and proactive in their health care. Now on the next page is self-determination theory. And this is one that I found as I was finishing up this semester when I was working on something different. And I thought it really had a lot to do with our chronic care management. The fact that self-determination theory has humans' three basic needs in it: competence, autonomy, and relatedness. And if you'll turn the page, I kind of gave you some definitions for those. Competence, being effective in dealing with the environment. Relatedness, the inherent quality of wanting interaction and caring experience. And autonomy, the ability of being a casual agent to one's own life. So if we can help patients to feel that way, then it helps them to better manage their chronic conditions. If you turn back and look at that again, the competence, needing to be effective in dealing with the environment. So we want them to feel more competent in taking care of themselves and that they have that ability to take care of themselves. Not that we have to find them what they need to do, but for them to find for themselves what they need to do to be able to take care of their chronic condition. And it works much better if the patients can be autonomous and make some of their own decisions. So that's kind of a shortcut on self-determination theory. And again, on that next slide, I printed out some more. Motivation for learning new information can be external or internal. External motivation is usually driven by rewards and punishments. So kind of like we do with kids. When they do things wrong and they get punished or they get rewards, and so they learn how to behave by what we do with them there. But it's not as effective as if we use internal motivation to help patients decide internally what they need to do, to help them make their own decisions, try to guide them, Of course, we wound up giving them a lot of advice when we talked to them in chronic care management, but if we could kind of let them start taking that on their own to say, okay, so what do you think that you need to do to be more healthier, to get your blood sugars, and kind of let them tell you what they need to do. And it helps us build the relationship with the patient in that we are here to advise and be supportive rather than just to tell them what to do. And this very last pages, it's the integrative health and wellness assessment. This is a short form. It's not the same form that we have in our charts. I really like this one, but Amelia had already decided on the ones for the charts. But if you look it over, I thought it might give us some question ideas when you're talking to the patients on the phone and you're not sure where else this needs to go. There's some things that you could talk to them about, how much sleep they get at night, what kind of strategies they use to manage their stress. I thought it might give you some question ideas for when it's hard to come up with what you need to talk to them about.
Has these for kids in the doctor's office.
And don't you like that?
Mm-hmm.
I do too. I think that it's real good and that the questions are real good. I really liked it better than the ones that we used for chronic care management, but Amelia had gotten those other ones out of the medical journal, and so she really liked that. This is really good nursing, and so I thought that you might like to have a copy of those so that you could have them when you talk to the patients on the phone. Okay, that's all I have. Do y'all have any questions or anything else that you'd want to talk about? Okay, well, thanks very much for coming. I appreciate it.